Mystery of Habits. We have two renowned names of psychology, Dr. Iram Bokharey and Madam Rabia Dasti. So, without delay, let's dive into it. And let's start with Dr. Iram. Dr. Iram, my first question is that what actually habits are? Like, how would you define a habit? What's the meaning of it?
Right. So the word habit has many definitions, and as is with the case with our profession, which has a lot of abstraction, quick consensus is hardly ever achieved. But to begin with, I think it's basically a habit is a learned cue response association which is activated when you are exposed to a particular cue, and that it automatically generates an act. So, to give you an example, when we say cue response association, we are keeping in our mind, uh, 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 a particular stimulus in the environment, and response is our behavior or habit, good or bad. And so basically, habits are tend to, when they are practiced over a period of time and a certain stimulus is evoking a certain response, it becomes ingrained in us. And that is when it is called a habit. Another definition could be that, a simpler one, that it is an acquired mode of behavior that becomes almost involuntary or automatic. Like, if we have a habit of fidgeting while talking socially, or we're not even aware of that and we still indulge in that. The thing that is very important, I just want to give an example to illustrate what I have said. So what I've said is one stimulus or reminder, and then a response or the habit, and then it leads to a reward. So basically, it's the 3 R's that are important to understand a habit. The first R stands for a reminder, which is a cue. The second R would stand for a routine, which is the habit. And the third one is for reward. So, for instance, like at King Edward's, like I understand most of the attendees are from there. So, at your university, if after heavy classes starting from 8 a.m., you are in the habit of taking a midday lunch or a snack, going to cafeteria, so that midday or hunger would be a reminder, right? And then, or a cue, as I said previously. So that's a reminder. Eating lunch would be the routine, the second R, and the your full stomach or refreshed energy would be a reward. Similarly, if you are in a habit of reading when you retire for the day and go to bed, reminder would be going into bed and retiring for the day. The routine would be reading, and reward would be the satisfaction that you gain out of that. So whenever we are trying to conceptualize and understand a habit, it's important that we try to gauge a learned cue response association, which is generated by exposure to that cue or reminder, and then it becomes almost automatic.
Oh, okay, so, ma'am, Rabia, what do you want to say about this?
I think Dr. Iram has pretty much identified or defined in very clear terms and given example as well. I would just like to elaborate on automacity. So automatic. What do we mean by automatic? How it automatically generates a non-conscious impulse or act. And so when we are habitual of doing something, we understand that much of it is efficient and not under our uh, like intentional control. Intentional control means that you're not aware of what you're doing, but you're still doing it, and it is acquired in a specific context, and that behavior is very specific, and it is idiosyncratic in nature inherently, because it would differ from person to person. Some cue would be different for another person. The cue would be different. For example, um, to refresh oneself, you would have a different cue, and another person might have a different cue to refresh him or herself. So habits are inherently very idiosyncratic in nature as well. And while habits are forming, it is essential that there is a reward system um, in place as well. But after the habit is formed, so then it is not important that the intent is a reward in itself. It becomes so much automatic, and it is like unintentional in nature, that you don't the motivation, the conscious motivation or interest dissipates, and habit becomes in itself a motive to do. So habits are basically another feature is that they are cognitively efficient. Why do we form habits? Because the automation helps us to achieve tasks, and very efficiently. We are able to free mental resources for other tasks, because we don't have to think much to execute a certain task. So automaticity had developed the behavior, and it has become a second nature, of and your brain knows what to do, and you don't have to put in that much of an effort to do that as well. So that is one of the important features and a very important benefit that habit has for us.
Okay. Thank you. So you, it sounds like you said that after some time, what happens is that motive is not there, but you are somewhat you are practicing that particular type of behavior you call habit. So can you please tell me that how will you differentiate habit from compulsion? What is the difference between these two?
So compulsion is basically a repetitive act that you do. For instance, when you have and its the end outcome is that you want a reduction in your anxiety. There is a distress that you want to reduce. Um, uh, that is the clinical definition of a compulsive act. So, for example, you're habitual of turning off light when you go out of a room, but a compulsive act would be to checking again and again if you've switched off the light properly, because you're anxious that you haven't switched it off. So a compulsive act would be repetitive in nature, and the end product or the outcome would be that you want to lower down your anxiety or neutralize your anxiety as a result of doing that compulsive act. So I would
Okay.
say that it is anxiety driven, and a habit is basically a learned response that is uh, initially it was reinforcement driven.
Okay. So I'll move on to Dr. Iram. Ma'am, what do you say about how the habits are made actually? Is there a proposed model for that? Is there a process? Or what's the thing that leads to making of a habit?
Before I say this, I just want to add a little bit. Rabia has explained it very well. Your previous question, the difference between a habit and a compulsion. So I think basically, in addition to what Rabia has just said, compulsion would happen usually, more often than not, but mostly in response to an obsession. And it leads to, like Rabia said, it tends to be repetitive and repugnant. Besides, it leads to psychosocial impairment in personal occupational functioning, and also is a source of distress. And if you follow international classification systems, it has to occur a certain duration every day for to qualify for the diagnosis. Now, coming to, do you mind repeating your question again, please?
Yes, my question was that how the habits are actually formed. Is there a proposed model, or what's the process behind that?
Right. So basically, the proposed model is the behavioral model. In psychology, we have many models which tend to explain the origin and maintenance of human behavior. So in this case, we normally, based on the definition, whatever me and Rabia have said so far, it is based on operant conditioning model, that you exhibit a behavior, and there is a stimulus response connection. You get a reward out of that, and that is what maintains it initially. And afterwards, of course, due to the involuntary and automatic quality, afterwards, sometimes there is lack of reward, because habits can be categorized as good habits and bad habits. I mean, you can be hardworking, you can be a person who exercises, etc. But you can also be a person who is into smoking. Just say, आजकल there is this fad about vape, and all of these things. So basically, it's the operant conditioning model, the behavioral model, that explains habit formation.
Okay, so you have just said about the good and the bad habits. I was coming to that point, but before this, I want to ask about this thing that we have talked about, the process or the pattern of formation of habits. What do you think? There are some factors like internal or external factors. What do you think is more important, or is there an equal you can say share of both of them in formation of habits?
So, as far as the external factors are concerned, the behavioral paradigm, the operant conditioning model, which involves the three R's, explains the interplay of internal as well as external factors. There is this, learned cue response association, and which leads to a certain habit, and then it becomes automatic as well. So one is that. The other is, if we look at it closely, it could be a modeling perspective as well. That sometimes we grow in an environment, and we watch others behave in a certain way, are significant others. And in families where we grow up, and sometimes we tend to live in extended families, those individuals, are significant others, become our role models, and we tend to identify with them. That is one element, aspect, important as well. Then there is this person, Rubin, who has identified, because you talked about the interplay of external and internal factors. She has identified that there are two basically needs. There are expectations from us, all of us, internal expectations and external expectations. So basically, she has identified four kinds of people who, if you want, I can elaborate later on them as well. She says that uh, people, some people who, because when I talk about social learning model, or uh, the what we learn from others, why certain people would learn habits and why they wouldn't would be because they are different kind of individuals. So she says that there are inner expectations and outer expectations, and there are four tendencies in us in how we respond to them. And then first she says that there are upholders. The first tendency, these are the people who, uh, meet both inner and outer expectations alike. Uh, and then there are questioners who only meet inner expectations more, and they question a lot, and they only accept things when they can be convinced to do that. Then there are obligers. I'm talking about children, I mean, because you're talking about how habits are formed. So, how habits tend to be formed is also influenced by who we are and how we meet the inner and outer expectations. Then there are obligers who would meet more outer expectations than inner ones. And then there are rebels who don't want to meet inner and outer expectations. Now, because they want to do everything their own way. Most people would fall in the obliger category, and rebels tend to be the smallest group. Now, whenever a habit is formed, it is also very much dependent on the kind of people, the kind of category that we are. All of us belong to one category or another. Another way of looking at this is that, uh, when you experiment, when you're young and you experiment with different habits, uh, you tend to find some of them relatively more rewarding than others. So, what really happens is that you tend to acquire them more. So basically, in habit formation, you will follow the same 3R pattern, the same pattern along with instrumental conditioning. Conditioning means that you're conditioned to behave in a certain way to a set of cues. And that tends to be very, very person specific, as Rabia said, because your cue to evoke a certain response may not be my cue or somebody else's cue. And then also it is informed by how we tend to respond to the inner and outer expectations out of these four categories that I told you. By the way, we do have a quiz, and if you want, Rabia has downloaded that, and we can send it to you, and you can find out within minutes which category you belong to, because that would impact a lot on the kind of habit formation that you would have.
Okay, yeah, that's really interesting. Kindly share that as well. And it was such an elaborated and good answer. Dr. Rabia, do you want to say something about this?
So I would just like to add about the models, and obviously the models would obviously suggest how you form your habits as well, and the external and internal factors that interplay in habit formation. So I think both of your questions are interlinked, and I'd like to answer them. Like already, Dr. Ram has answered the psychological part, but I would just like to shed some light on the physiological basis of how habits are formed. So once you develop associative pathway, and so basal ganglia, which is a part of the brain, has an important role to play in habit formation. So the associative pathway in basal ganglia, it consciously collects information needed for reaching such goals, like staying warm, finding food, finding mate, or expressing oneself artistically. So that's the associative part. It collects information. The second part, which is also the pathway, is the automatic pathway, which it takes roots through lessons learned from the first pathway. So the associations that you've developed in the first part, would become more and more automatic when you're repeating them. So that repetition would store the information for your habits, and then that pathway would be easily accessible to you. So neuroscience would say that your the habits, the routine that you follow would become more and more accessible to you through those pathways. And like there are more synaptic connections, there are more neurons that would help you in easily accessing the information that you've already stored. So one of the psychological theories I would like to also add on would be the internal ideas of or maps that we developed as cognitive components that helps us navigate through the environment that we live in. So when we are repetitively practicing something, we have our cognitive maps developed, and they help us in assessing the information more easily, and habit therefore becomes more easily to implement. And you like around 40% of your daily routine is based on your habits. So likewise, the third aspect that Dr. Iram highlighted is the cue routine and reward cycle, the 3 R's that have already been discussed. I think they've been discussed in detail. I would just like to add that the internal or external cues can be like boredom or embarrassment, or these are the not feeling well inside, or you have certain need that is unmet, and that cues a certain habit. For example, when you're bored, switching on the television or taking the telephone, like your mobile, and um, going on to the social media would be a cue. And an external cue would be friends around, that can be an external cue. Any sort of external stimulation that could point out that this thing has to be done in this particular moment, can serve as a cue. So external cues can vary, and also internal cues, your mood, your thoughts, your feelings can be internal cues, and external cues can be multifaceted. And obviously the ease of response, how ease that like how if the task is easier to do and you think that you're capable of doing that, you have that potential, so the habit formation is much more easier than otherwise. And the potency of reward, also the importance that you place on reward, and the uh, because rewards can differ for different people. Rewards are also idiosyncratic. One thing that is rewarding for me can be like not rewarding for you. So based on how I feel that the potency of the reward or the importance of the reward for me would help me devise a specific habit. So I think we were talking about this. With, like you asked another question also. Can you repeat that?
I was going to ask another question. Your this thing, the physiology you explained is really amazing inside. It's very exciting to know about it. I also wanted to ask about this. That how will you define like a particular habit or a certain habit is good or bad? Like, what's the parameter of or what's the meter or metric you have set to say a habit it's good and it's bad?
So the first parameter would be how it is impacting you as a person. Or the second parameter would be how is it impacting the people around you. Um, and obviously, as Dr. Iram pointed out earlier, the other parameter would be how problematic it is in terms of intensity, duration, frequency. and the impairment that it is causing you, both individually or socially or academically. So we as clinician would take these as parameters of how problematic a habit would be for you. And a good habit would be something that would be consistent with your value system. Number one. Number two, is helping you achieve your goals in life, whatever you set up for yourself and you think that is important, and is helping people around you as well.
Okay. So, what do you want to say, Dr. Iram? How will you say a habit is a good or bad?
So, first of all, in psychology, we say that it's better not to use the terms good or bad because they are like judgmental. Adaptive and maladaptive is a better word. But
Okay.
I think Rabia has given a very comprehensive answer. Two, three things. I'll just be repeating her, I think. Much like that, she's explained it very adequately. It is the distress caused to you. And since, we can't live on imported Western models, so in our society, since the institution of family is really strong, so a habit that you have, if it causes distress to you or the significant others around you, and if like Rabia said, frequency, intensity, duration, may it exceeds a certain level, and it you are preoccupied with it, more often than not, and it, let's say, exceeds 2 hours per day or 1 hour per day, and it is hindering in your daily routine, then, and as Rabia said, it's taking you away from your goals. Um, mm, by the way, goals is a very umbrella kind of a term and a bit confusing as well. So if your goal is to be, spiritually escalated or be a very useful person, it means different things for different people. So we tend to divide them into tangible, reachable goals. And then we also divide the duration in which we might be able to achieve those goals. And if we feel that the sub goals are being hindered that you have outlined for yourself, then surely you need to bring about a change in that habit.
Okay. So, I want to know more about this. That you said that we can bring about change in the habit. What do you think? Is it possible, or how easy or how tough it is to bring about a change in our habits?
Are you asking me or Rabia?
I'm asking you.
All right. So, Fiza, the first and foremost, whenever you, in psychology, whenever you try and bring about a change in a habit, a behavior, we always conceptualize the readiness for change using a model which is called Prochaska's change model. And it's very important. And I think you're all very young people here. So I'm just going to describe that to you, and you will understand how to, assess which stage you are in. Because if only people around you are telling you to change this habit and that habit, and you don't have that intrinsic motivation to go about it, then no matter what you do, no matter how much they bang their heads against the wall, you're not going to change. So that's why this understanding, this conceptualization really helps. So Prochaska basically says that uh, the first stage is pre-contemplation, which means that you're not aware that your habit is a problem, and you have no intention to change. So at this stage, so nobody is going to change. Then there is a contemplation stage where you become aware that the problem exists, and you're thinking about changing. You're contemplating the change, right? उससे पहले तो आप कर भी नहीं रहे थे, you were not even aware. In the third stage, he calls it preparation stage. In this stage, you develop an intention. You're not only aware, because you become aware in the contemplation, and in preparation, you develop an intention to take actions to change. You know, you start asking yourself that, oh my God, this habit is really disturbing me now, and I need to do something about it. So, what are the options? So you develop that intention. You start looking around, and in the fourth stage is the action stage, and you start making modifications in their behavior, in your own behavior, and because you start reading up and you start seeing that, how am I going to, if there is a reminder which leads to a certain response, then how am I going to, we exert, normally we use a technique, it's called stimulus control, so we avoid facing the same reminder for a while, and hoping that then the same habit will not occur. So that's the action phase. And then there is maintenance phase, which is that the modifications that you've made to change your habit, and you are almost there, although it hasn't really strengthened, because the more you practice it, the more it will get strengthened. So that's the maintenance phase. And some people say it's a step model, some people say it's a six-step model. So the sixth step would be termination, in which you have achieved 100% self-efficacy. I shouldn't say 100% because I'm a psychologist, so it's not a precise science. Imperfect knowledge isko kehte hain. But adequate sense of self-efficacy and control, and the temptation or the craving to go back to the habit is absent. So to answer your question, first and foremost, if you want to change any habit, you will have to assess where you fall. I mean, anybody who wants to change, where one falls at this stage. If the person is at the pre-contemplation stage, then maybe, he will not, whatever he does and whatever anybody asks him, he's not gonna make any effort. But at contemplation stage, the awareness is there, and he can use a host of techniques. He can do a cost benefit analysis and see how functionally impairing his or her habit is. And also, he or she can tell themselves the concept of short-term hedonism and long-term hedonism. So whenever we give in to a habit which brings a temporary relief, uh, uh, we are just thinking short range, short term. And to lead a life, we need to be goal oriented, and we need to look at and formulate our long-term goals, properly. And if we feel that there is a discrepancy between the fact, our current habit and our long-term and short-term goals, then we develop the motivation to change it. I hope that answers your question. If it doesn't, you
Yeah,
can
yeah,
ask me another question.
that's really answered my question, and it has covered another topic as well, like a person who wants to change his or her habits. I think this is the first step. The steps you have mentioned, that in which category you fall, actually, that's the first step towards that. Now I want to ask from Dr. Rabia that what's her opinion in about this thing, that say a person wants to change one or some of his habits. What are the techniques and what are the ways in which we can achieve this thing?
So first of all, because habits have become very automatic for us, the first step would be being aware of our habits. And when we are aware of what we are doing, then only we can change it. So then we can contemplate, or we can prepare or take actions about it. But if it is an automatic thing and we're not even aware of what we are doing, we're not going to do anything about it. So the first step would be being aware, like through self monitoring, being aware of what you're doing, why you're doing it. Then understanding the cues. What are the cues that are making the habit more like the cue that would trigger the habit? So one of the strategies that you can do, number one, is to make the cue invisible. So to make the cue invisible is like either you make some changes in the environment or use the term that Dr. Iram also mentioned to stimulus control. So either you control the stimulus, you make it invisible, or you make any changes in the environment. For instance, um, making the cue invisible would be not going if you think that you are overeating and you're eating more sugar, you're taking more and more sugar intake. So what you can do is to take away everything that you that is accessible. For example, cookies or chocolates. People who are overeating or taking more sugar intake usually would do what they would hoard such stuff in their room or in their kitchen, and that would be more accessible for them. So what you would do is to make them inaccessible for yourself by not buying them or not having them easily accessible to you. Um, Number one, that is controlling the cue or making it invisible. Or for instance, if you go to the restaurant and if you go out, you usually do what you do is you would go to a restaurant and eat there. So what you can do is by avoiding the queue or making it more unattractive is that you would eat at home. So when you have a full belly or you're filled up, when you go to shopping, so there's a less likelihood that you will eat outside because that becomes more and more unattractive for you. So one is that making the queue invisible. The second would be making it unattractive as well for you, so that you're able to hold back the craving for it. The third is making the response more difficult. So, making the response more difficult would be um, if you tell yourself that obviously, if you don't have access to the sweets at home, the response would be difficult because you would have to go to the market now and bring something for yourself. That this would add one step to the habit cycle, and that would be difficult to do. So, if the response is difficult to do, you're more able to control that habit or work on that. The last would be you make the reward unsatisfying. So, you consciously weigh what are the rewards, like Dr. Iram has already mentioned, long term hedonism and short term hedonism. So you weigh what you're doing to yourself right now by doing this specific habit and what would be the long term effects. And on the other hand, making the competing habit, the habit that you want to adopt, like the good habit, more satisfying for yourself. For example, if you choose to eat vegetables, so you make it more satisfying by like trying new recipes for that, making it more attractive for yourself by adding some spices or some things, uh, and then weighing that in the long run, you being more active, you're more energetic, you're more goal directed, you're adding something to the value of your life. So I think these steps would help to break a bad habit and create a good one.
Yeah, that's very helpful. I want to ask another thing. Like, these are the steps that one can practice to change his or her own habits. But then there are some circumstances in which we actually no, we are not in control of that change. Like, say for example, there's a child and he or she is practicing a bad habit, and he has not reached that certain level of understanding about it. So basically his parents are in charge, or his parents are responsible for his or her good or bad habits, and they want to change that pattern, or they want to change that behavior. And we have seen that sometimes parents practice some things like punishment or scolding and this and that. Do you think that these things are effective in changing other people's habits? Or if
So
they
you're
are not?
asking me.
Sorry, I'm cutting, but I want to ask, like, if you think that they are not effective, then what alternatives should be practiced in order to be more effective?
So, for instance, you want your child to develop specific habit. The first step would be reinforcing that habit every time. Like whenever the child like indulges in that habit, you have to reinforce that. It should be based on a continuous reinforcement schedule, rather than intermittently doing it, like reinforcing it sometimes and then not giving attention to it at the other times. So what is the most important thing in habit formation or development when you're doing it with your child is, you should reinforce the good habit every time it occurs, to make it more um, uh, permanent, or more to stabilize it. Um, the second step would be to make smart goals with the child. So be very specific what you want the child to do. It should be measurable, it should not be abstract. You should be able to measure it. For instance, you're able to brush your teeth every day is a measurable task. Everybody could see it. If it would be an abstract thing that you didn't respect me, would be an abstract thing, and you can't measure if the child has respected you, or if the child hasn't respected you. It should be achievable for the child. It should be realistic. It should not be very complex for the child, and it should be time bound as well. So this is the definition of smart goal setting that we do for children. And when they do it on the regular basis, it becomes inculcated in them as habits. Um, so what you want to do is you want to help them make smart goals and learn through those strategies. For instance, if the child is already indulging in behavior that is disruptive, so the other strategy that you would do with the child is differential reinforcement. So you would reinforce the positive behavior, a competing positive behavior that you will operationally define as well. What do you mean by a positive behavior? And the competing negative behavior, you would either ignore it, or you would not, like you will ignore the competing negative behavior. That would help you to differentially reinforce the positive behavior and enhance its mm, uh, occurrence. So this is one of the strategy, and then comes the punishment techniques, which are the least favorable. We would not, as psychologists, ask somebody to initially enforce punishment techniques to children, because that would create much more anger and um, negative emotionality in children. So the first strategy should always be positive reinforcement, followed by differential reinforcement if there is a competing negative behavior already existing. And then, if there is a behavior that you're not able to manage through these techniques, then only you would follow up with the punishment strategies. Fiza, are you able to hear me?
Sorry, my mic was mute. Yeah, yeah, I understood the thing. I was asking Dr. Iram if she wants to add something about this thing, like changing other people's behavior. And by the way, I also want to ask this thing, like we have talked about children behavior. Do you think it's possible that we can change the habits and behaviors of adults and especially the 40 plus age group? What's your opinion on that?
Yeah, thank you for asking this question. But can I add just a bit to your previous answer, like how we can change habits in children? It's just that
Yeah, sure.
when we apply, Rabe has very rightly said that the first strategy that we use for inculcating good habits in children is reinforcement. But while we apply reinforcement, uh, uh, three principles are very, very important. In fact, couple of them, maybe four. One is that it is contingency, that whenever the child does that, as Rabia already said. Second thing is consistency, and for third thing is immediacy, like because the child has a young mind, and perhaps mental sophistication isn't still there. So if you apply the reward right after the occurrence of adaptive behavior, then the child forms the stimulus response connection, and he learns. For example, if he's showing a tantrum and then you attend to him, or give him a candy, when he is fine, then you start doing that, and then he develops the stimulus response connection. Also, it is very, very important in our culture, especially when we're dealing with underprivileged class, such as in Mayo Hospital, that you always pair a tangible reinforcer with a social reinforcer. So if you're giving the child, a candy because he's exhibited adaptive behavior, you will also say, Shabash, great, bahut acha bacha, because social reinforcement is limitless, and is very economical. There's no money spent in that. And ultimately, we would want to withdraw all tangible reinforcement for habit formation and just depend upon social. Now, to answer your other question, that people in 40s and 50s, how can we bring about a change in them? I think I would again resort to the model that I shared with you all, that when we try to police people or bring about a change in them, and they do not feel intrinsically motivated to change that habit, uh, it's almost close to impossible. Now, for instance, I mean, in Mayo Hospital, we have a separate unit of drug dependence, right? And so whenever the family brings the patient, chahe, whether they emotionally blackmail the patient into coming, or whether they withdraw all his reinforcers and all his pocket money and all of that, unless he or she is motivated, they do not leave that. So I think the best way to go about that, if the person is in, let's say, pre-contemplation stage, he would not come to you, but what the family can do is that they can draw a discrepancy between their current behavior and where is it taking them. Because for instance, in case of addiction or overeating or whatever you may want to call it, it's very difficult for a person unwilling, because I often witness those people running away from the ward, or tipping a bearer in the ward to get them drug, or even leaving the ward for a while and to get drug. So intrinsic motivation, I think, is extremely important. Now there is an exception to people. Sometimes people get into a habit of throwing tantrums, like shouting and causing a lot of distress. Some people may be sick in the family or old in the family. At that point, I think we need to intervene, but then it won't just be a habit. It will be a sum total of a cluster of symptoms that would have qualified for one psychiatric disorder or another.
Mm. Yes, I think that is. Now I want to ask something like any media reference. Do you think there's a book or a movie or a TV show which you think like we can watch or read to better understand this the habits and behaviors, and we can better understand our own selves regarding this topic? Do you think there is some kind of thing?
I think I can recommend you a few books that have helped me, in my own life and with my clients alike. So one is the Habit Handbook by Jack Morris. Then there is Zen Habits, Mastering the Art of Change by Leo Babauta. And then Better Than Before by Gretchen Rubin. And Rubin also has a lot of podcasts. And I think Rabia can elaborate further.
Yes, another book by Ruben is The Four Tendencies. You can also look into that. Um, Also, a bestseller is The Seven Habits of Highly Effective People. It's a bestseller. You can read through that. It would give you the habits of effective people who are very successful as well. Um, so I think these are very good books. You can look into it, and they can be very helpful for each one of you, and they are helpful for us as well.
Okay. It would be best if you both of you could please write that in chat or in WhatsApp group so that people can who want to follow this can easily get this thing. Okay. Thank you so much, Dr. Iram and Ma'am Rabia. It was such a wonderful session, and I think it helped a lot of us in understanding our own behaviors and habits. And the most important thing was the most important topic. I think the most practical one was the change of habits and how to convert our less effective habits into more effective ones. Thank you so much for being with us. I'll move to the audience. If anyone has a question, he or she is more than welcome to ask.
I think there's only one, and it was how trauma can affect our habits. I think we can spend a couple of more minutes because we have
Yes.
for the answer from either Dr. Iram or Madam Rabia. Let's start with Dr. Iram, ma'am.
Yeah. I think trauma would definitely affect the habits. It depends upon what the trauma is. Um, you know, you can uh, become reclusive. You can start indulging you can become asocial. You can exhibit uh, an isolation or overthinking, because trauma, when we talk about trauma, we can't just talk about habits. We will first have to rule out PTSD and other related disorders, because let's say if it was sexual abuse, like today there was a farewell of Dr. Aftab Asif, our HOD, recently retired. We met at a lunch. So this psychiatrist, an ex-HOD, says that when she went back to her home, her entire home was burnt, and all the valuable things had been taken away. And she said, I'm still under the shock. It has been 2 weeks. So I think first and foremost, we would rule out the disorders. And second thing, then it's not only a 3R thing, in my opinion. Then you would have to see an amalgam of negative emotions, not only behavior, as in habit, we have discussed the 3R phenomena, and not only operant conditioning. We will have to see an amalgam of negative thoughts and emotions as well. That, do you consider yourself as a victim? Do you are you angry at God, at fortune, at people, generally at yourself for being neglectful, or for being a party, for being a part of that, or for acting as a victim? And then also a host of emotions such as, guilt, anger, resentment, shame, and you name it, the depression. So I would say that I would not then just look at habits. I think a person would really be lucky if he escaped all these disorders after trauma and only resorted to a habit. I think Baki, maybe Rabia can elaborate more on that, because I would definitely do a mental status examination to gauge what the person is suffering from, and then come to habits.
I agree with Dr. Ram because habits are very specific in nature. And when we talk about trauma, trauma would impact the global aspect of a person. It is very much likely that trauma would have a very far reaching impact and a global impact on a person rather than just having specific impact on specific habits. So I think the first most important thing, clinically speaking, is to assess for different psychopathologies, depression, PTSD, acute stress disorder, dissociations, and then we can be more specific and see about what impact it has on the behavioral patterns of an individual.
Okay, thank you. So there's another very interesting question lined up, that how can we, break the habit of excessive phone usage, cell phone usage?
I think before this, there is another question. What about biting habit? How it can be reversed, as the techniques discussed were cue invisibility, change of stimulus, so making response more difficult. So basically, even with habit of excessive phone, we can use it, and nail biting as well. Rabia mentioned differential reinforcement. Now, this is a technique which has four types. So, in these two kinds, the use of differential reinforcement with incompatible behavior would be very helpful. So, when you bite your nail, of course, you are using, you're biting them. So it's the use of your mouth and your nails, right? So if you were to be rewarded, or uh, somebody doesn't need to do that, you can do it to yourself too. It's called self-management procedures and behavior therapy, that you reward yourself, for instance, for playing with your hands, playing a jigsaw puzzle or doing something with your hands. You can do anything, and then you reward yourself for that. So this would automatically decrease nail biting. And same goes with phone usage. Another thing which is very effective, and many of the people in my circle are applying, is stimulus control, because what they do is that they go offline for a couple of days to give themselves a break. Otherwise, we are tied to this device, 24/7. So, like when we go to bed, maybe we can put it away somewhere, So that is also a strategy that can be used. And Rabia can, of course, highlight further.
So for nail biting, people have also used like differential reinforcement. But other than differential reinforcement, if it is not working, people have gone to aversive techniques, which are punishment oriented. Like they've placed something like कड़वी कोई चीज लगा दें या कोई इस तरह की ऑयली चीज लगा दें जो aversive हो, and you'll go like take it to your mouth and you will feel an aversion towards that, and that could also help reduce it. um, with reference to the 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 media usage or phone usage thing, so one of the things is that it is always also cute. For instance, जैसे ही हम फेसबुक खोलते हैं तो हमें कोई नोटिफिक मतलब अभी हमने हमारा फोन लॉक्ड होता है और हमें नोटिफिकेशन की बज आती है. So what we do is we instantaneously pick up our phone and unlock it and see what's our response is, seeing the notification, unlocking it and seeing the notification, and then we get a reward sense of satisfaction. So what you need to do is to identify what you're doing. Number one, to be very aware of the fact that you're doing it, because habits we tend to be automatic, and you first have to identify that you're doing it, and then you have to uh, make a decision that you want to change it and why do you want to change it. And then if you have made the decision that this habit is not helpful and you want to change it, then you have to devise strategies. Like I said, that um, you can, whenever you have the notification, either you will uh, like implement a delay tactic. I am not going to see it right away, and I'm going to delay my impulse for checking it altogether once, like जैसे ही आपको notification आता है. So you can also implement stimulus control. जैसे आप कर देते हो कि आप उसको like उसको कर देते हो कि आपको ना आए नोटिफिकेशन, या फिर आप उसकी ट्यून जो है वो साइलेंट कर देते हो कि आपको रिसीव ना. सो व्हाट यू डू इज यू ट्राइंग टू कंट्रोल द स्टिमुलस सो दैट वो जो हैबिट क्यू और हैबिट की जो एसोसिएशन है वो वीकन होती जाए until the time you have a coping resource to help yourself. यू स्ट्रेंथेंड इनसाइड कि मैं अब इसको खुद से कोप कर सकता हूँ. हमने एक कोपिंग मैकेनिज्म अंदर डेवलप कर लिया हो टू हेल्प यू डील विद दैट rather than giving in to that.
Thank you so
And
much. As
and
our time's
obviously,
up, so
सॉरी,
yeah.
एंड ऑब्वियसली मेकिंग इट डिफिकल्ट फॉर यू. जैसे आप उसको अपनी साइड टेबल पे प्लेस ना करें, किसी और टेबल पे जो आपकी बेड से बहुत दूर हो. जैसे सोते वक्त ज्यादा लोग कहते हैं कि हम यूज कर रहे होते हैं, सो प्लेस इट समवेयर विच इज डिफिकल्ट टू गेट. एंड आजकल जैसे सर्दियां हैं तो यू लाइक टू बी इन योर बेड इन योर comforter, and it would be difficult for you to get up and go and get your mobile and see who's on the other end and what is the message all about.
Thank you so much for these ideas. We'll try our best. And thank you so much, Dr. Iram and Ma'am Rabia, for your time and participation. I hope we'll further conduct such knowledgeable podcasts. And with that, we end our today's session. Okay, Allah Hafiz.
Allah Hafiz.